Children who've been incompletely vaccinated and adults who have not received a booster vaccine for pertussis have an increased risk of more severe symptoms and complications. Pertussis is treated with antibiotics, primarily to reduce the spread of the infection and to help shorten the illness. Supportive care to help with the symptoms may include using a cool mist humidifier and over-the-counter cough medicines based on the age of the patient. Over-the-counter cough medicines are not recommended under the age of 6. Immunization against pertussis is given with the DTaP vaccine, starting at 2 months. The vaccine is given at 2, 4, and 6 months, with boosters at 18 months, 4 years, and 11 years. A child who has not completed the entire series is more at risk than someone who has received the complete series.